Getting advice when you're pregnant is not always easy. Perhaps you live far from a clinic, or the advice you get from friends and family might not be correct. And that's something that Gbemisola Boyede is trying to change in Nigeria. She's a pediatrician and started an online support group called Ask the Paediatricians, which now has almost 500,000 followers. She's one of over 100 people around the world who have won financial support and mentoring for a year from Facebook for their community work. Dr. Gbemisola joins us now on the line from London, where she's moved to work earlier this year, but still runs the Ask the Paediatricians website. Great to have you with us, Dr. Gbemisola. Now, we assume that young mothers will get good advice, but what you found is that you had to do a lot of myth busting with your advice. What kind of myths? Give us examples.
Okay, yeah, we found out that in Nigeria, lots of mothers get information from the grandparents and other older mothers. And there are a lot of traditional beliefs and myths around this. For example, some will say the first milk that come out from the breast, which doesn't look so white, what we call colostrum, should be thrown away because it's sour milk. And actually, this colostrum is very, very important in protecting the newborn babies against infections because it's full of antibodies. So these are some of the myths that we are correcting on Ask the Pediatricians to let mothers know that such colostrum should not be thrown away, but rather they should be given to the baby, and all the babies should also be exclusively breastfed as well.
And I'm interested to know when you say that people, or when you say that mothers to be depend on family and friends for advice, is it because of lack of access to professional medical advice, for example, in rural areas of Nigeria, remote areas, or not necessarily?
Yeah, that is also that is one of the reasons, because we don't have full access in some places to healthcare professionals and information, and also because of our cultural setting, people rely more on getting information from their neighbors and from their friends rather than going to the hospital, because sometimes they have to wait long, and sometimes the doctors or nurses are so busy to give them enough time for health education and things like that. And I now saw that practice also coming online, people coming on Facebook, posting questions, and non-professionals are giving them advice. And some of those advice are completely wrong and very dangerous. And that is one of the reasons why I started Ask the Pediatrician platform, where people can get professional advice from the pediatricians directly about their children's health.
They get it online, though, on Facebook, which I'm curious, if someone, for example, is in a far-flung area where they don't have access to professional medical help, do they have online access to get to you and ask you and others questions?
Well, these days, many people now have the mobile phones, and most of them are, I think the access to having internet and mobile phone is increasing, maybe more than the health facilities. So most people are actually on their mobile phone, are able to access Facebook, and they're able to ask their questions there. Yeah.
And are all of the people that get in touch with you, the women that get in touch with you, are they from Nigeria or elsewhere from Africa?
Oh, no, we have a global platform, so we have people asking questions from all over the world, but Nigeria constitutes the majority, but we have people from Kenya, people from Uganda, people from even US, UK, people ask questions about their children's health on our platform. Yeah.
Now, of course, there is merit in giving people advice and demystifying some of these issues, myth busting, but you're doing it remotely. And I'm just wondering if, for example, you find that, a certain patient or someone is in need of medical intervention, what happens then?
Yeah, we usually advise, even on our platform, is purely health education and information. So we don't give diagnosis, we don't treat anybody online, we don't prescribe medications. So we always advise them to quickly go to the hospital in such instances. And one of the group rules is that you don't post emergency questions. And one of the things we do on our health education platform, sometimes I do ATP Live programs, is to sensitize mothers to know that these are emergency conditions. This is when you go to the hospital. This cannot wait for you to ask on Facebook or anywhere else. You must take your child to the hospital immediately. And we've had instances like that. In fact, there is one that I had to personally reach out to the mother offline and make sure that she got to the hospital and get her child treated. And right now the child was fine eventually. So we try to do that. We try to avoid people
not getting to hospitals.
Yeah.
Dr. Gbemisola, many thanks for joining us.